Right, I want to thank everybody for joining us for today's webinar entitled MedLab Futureproofing, How to Conduct Outcome-Based LIS Selection. Today's presentation is brought to you by Asterix and presented by Labvantage Medical Suite. We can go to the next slide, please. Before we get into today's material, I want to take a moment and introduce you to Asterix Technology. If you have not been privy to any of our presentations that we've been running, we have been pretty busy the last year and a half here. We've been running quite a few webinars and webcasts, bringing together thought leaders from around the lab informatics space, and we've got a great one today to share their vision of where the future of laboratory informatics is going, and we're going to get into that today. In terms of who we are as a company, for over 25 years, our unique breadth of highly specialized services, processes, and technology has enabled Asterix to be a leading partner in transforming the way science-based businesses succeed. And we do work almost exclusively with science-based businesses. We've been doing so since 1995. We work with a lot of different vendors, such as, of course, Labvantage in the space, and we are vendor and platform agnostic. We have locations throughout the United States and overseas, and today we employ 1,200 employees. The cool thing about us that I always like to point out is 90% or more of our team members hold advanced science degrees. So we are a science-based organization. We're headquartered in beautiful Red Bank, New Jersey, and we help clients in a variety of different sectors. Startups, Fortune 1000, life science enterprises, chemical, CPG, government agencies, and research institutions all benefit from the services that we provide. And next slide, please. I'll tell you a little bit about specifically what these services are. We like to say that we support the continuum of scientific operations and data management. And within that, there's certain categories. We help with strategic innovation roadmaps and enterprise architecture. In short, you feel free to read this in detail, but in short, this is helping companies understand what kind of technology architecture they need to bring their lab into the digital age. We help with data management and governance. This is everything from implementing strategies and methods and frameworks to make sure your digital assets are up to speed with what the FDA requires. Business analysis. This could be understanding, who are the people, processes, and technology that are going to be required to execute against your business plan. Solution selection services. This is helping companies pick the right technologies to build their laboratory technology stack with. And then from there, we can help with development, implementation, and validation. And then even at the end of it, we can help staff, both scientific and technical resources to help bring your vision to life. So that's a little bit about us. Let's switch gears and introduce our speaker for today. That'll be next slide, please. Sandra Slater's joining us from Labvantage. She is technical sales support specialist. She's got a storied history with a lot of great background, everything from a business analyst to consultant, through technical specialists in HLA, to laboratory technologist in chemistry. So we've got a great background. I'm going to let Sandra take a moment and introduce herself a little further. So I certainly wouldn't do her background justice. So Sandra, if you want to take a couple of moments and just continue with the introduction, and then from there, you can pick up the slide deck and I'll come back on at the end.
Sure. So my name is Sandra Slater, and I do work for Labvantage Medical Suite. Labvantage is fairly new for their clinical medical suite to the USA, very well known in Europe, and we're part of the Labvantage LIMS product as well. We share the same database. My background, I was a lab technologist for years, and I did many different specialties through to chemistry. Even as a student, I worked in micro. I've been through like toxicology, many different areas. I ended up specializing in transplant, brought in an LIS system in transplant and worked on that, and then went back to, I'm Canadian originally, so I went back to Canada. I got recruited into IT, and I've been ended up consulting on the West Coast in California with a massive project with Providence St. Joe's Health. Worked for them for a number of years, and then went to Abbott with a reporting tool they have, and now I'm with Labvantage. So I have a very, very varied background, and I know quite a bit. I've worked on and with many, many different LIS LIMS products over the years. So that's pretty much it about me, and I will carry on now with the rest of the presentation. So in the 1980s laboratory, LIS software would best be described as DOS. There were limited choices available. You're either typing in a CD prompt or typing in a number to bring up a menu. And I'm sure some of you do remember this. A GUI wasn't even a thought. So that means like a pictured menu wasn't even a thought back then. Our systems were slow and clunky, but a vast improvement over writing results on requisitions and putting paper reports and sorting them into doctors' mailboxes. I did that as a student. Microsoft was just getting going with a new statistical tool called Excel, and it was slow and painful by today's standards, but it was an improvement over manual gathering and collecting data. In the 1990s, more LIS software started hitting the market. New features became available, and now LISs could be used for multi-facility purposes. The software generally now was tied into a newly developed HIMSS product or HIS product. So the laboratory was no longer the software's primary function, and the lab started taking a back seat for development. The focus was and is to this day on doctors and nurses' documentation, admissions, and financials. Another issue with these new systems was that many of the programming languages were proprietary, and the analyzers were extremely difficult to interface. Integration with third-party systems was next to impossible, and LIS companies didn't want you to use other applications. And it was and is to this day in some systems extremely difficult to extract data in a usable format for statistics. Trying to get on the radar for an excellent report writer could take months, and it took great expertise to develop a report because of the complicated programming language. And the systems being a desktop application had to usually run with virtual desktop applications in an environment like Citrix. If the healthcare system was large enough, sometimes Citrix would cause, or other ones would cause bottlenecks during peak times. And there's also extra costs associated with support for that type of environment. Then came the Obama era, and there was a focus on meaningful use, and this put pressure on our healthcare systems to develop one electronic healthcare record for their system. And more independent hospitals started merging and partnering with larger healthcare systems for buying power and reducing costs associated with maintaining their HIMSS or HIS system. In 2015, the government brought in MACRA, which is the Medicare Access Chip Reauthorization Act, and MIPS, Merit-Based Incentive Payment Program. This changed Medicare and Medicaid quality and billing rules, giving bonus incentives for payout, what they classified as APM or alternative payment model for services and testing, or you were penalized and you had reduced payments. The system brought in increased quality measures to be met, and if they were satisfied, you could get up to a 5% bonus paid. If hospitals and labs and doctors did not meet these standards, then there was a penal system for the services and testing and reduced payments, and a possible loss of being able to do work for Medicare and Medicaid patients. Now I show this, and I show there's an increased cost because I worked with pathologists in previous employment, and I know that they had to start paying billing companies to be able to extract the quality measures. I think they went from 3 to 8 or 10 quality measures that now had to be submitted to the government, and they now rely on their billing companies to do this for them. Okay, so healthcare has advanced at a rapid rate. We've gotten to the point of pinpointing spots on DNA to help with diagnosis and treatment for cancers and other diseases. With this, laboratory services have had to keep up. More and more tests are available, and with those, more unique analyzers for specialty testing. DNA analysis has gone from taking a minimum of 8 to 24 hours in a cycler, and then manual testing, to getting results out in 30 minutes for some analysis. Chemistry analyzers, which I'll show you, you can see the thermal cycler on the left. I remember working with that type of equipment. I know I'm aging myself, but you can see now that chemistry analyzers have gone from pump tubes being changed on a night shift and making reagents and pHing them to minimal maintenance and reagents available in kits. Tests that took hours to get out in a night shift are now out in seconds. I participated in the manual laboratories that became completely automated within 2 years. The government has made healthcare systems report rates for certain illnesses and diseases. They have made, so with that, you have to interface patient data, including demographics, diagnosis, and results to different state databases, which include the CDC, COVID results, and some of the cancer registries. I worked on cancer registry projects. We've gone from paper to Excel to Access. We actually worked in a transplant lab that we used Access for a database, to Power BI and other software for business intelligence. But now we've leaped forward, and we have in the here and now the ability to be able to do predictive machine learning and artificial intelligence. We actually have a sister company called TCG Digital, and I'm going to show a couple of slides on that. And these are dashboards that have been set up for some of the analytics for healthcare systems and clinical trial laboratories and pharmaceuticals, but these can also easily be set up for laboratories. And you can see the type of ability now that's available at the touch of a hand, a finger. The healthcare systems and laboratories are constantly looking for ways to cut costs and replace staff. Let's face it, post-COVID has caused a crisis in every country. There's not enough labor available for all the jobs out there, and this has caused a crisis in healthcare because there's more sick people than ever. What does this have to do with laboratories and the information management system? Because of everything discussed, laboratories are faced with more of a challenge than ever. LIMS and LIS systems must keep up with the times. Many fall short, which only means additional cost to the laboratory and the healthcare system. Quality measures are not being met. Accreditation is always stressful. Mistakes are being made, and extra costs for duplicate testing are not being caught. Laboratory management is becoming more and more stressed because of them trying to make a system work that just doesn't function the way they need it to. There's more need for statistics and analytics than ever, and the LIS vendors are not keeping up with the times simply because they don't have to. It's the HIMSS system that matters. If you take a look at this slide, you can see that they've estimated a $2 billion a year for unnecessary tests and procedures being done. And if you look at the right, I believe this was for the state of Iowa, and you can see that purple is the demand. I think the blue is the actual workforce, and the gray are the people retiring, and the green are the people graduating. So this just shows the type of impact and what's happening in the future to our workforce. It's kind of scary, actually. For smaller laboratories, they can at times be running on a shoestring budget. The past has anchored them to an antiquated LIS system, and it does not function the way they need it. The risk of implementing a new system might not be any better, but they've never been approached about the cost for a new system and have never been presented to them in a way that shows savings and higher profits to the laboratory with a good LIS system. Many laboratories buy other laboratories out, making them medium to very large reference testing laboratories with expanded testing menus. This is happening all the time now. With these acquisitions come multiple disparate systems that do not communicate and cause loss of productivity, and added staffing for maintenance costs need to keep all these different systems up and functional. It's more difficult to fully integrate services because there's not a single structure in place, and this bottom line is this increases the cost of testing. With these slides, what to look for in an LIS system. I'm going to go through a few of the parameters here, what people should actually be looking for and what's important. One of the number one things is security of your system. They should be following advanced security, complying with ISO and IEC standards, including the Privacy Shield framework. FDA has an FDA 21 CFR 11. This is compliance for audits, e-signs, and access control. Very, very important. This is a standard that a lot of CROs and clinical trial study laboratories have to have, and not everyone has this certification. So when you're checking out an LIS, make sure that you're checking into that, because I know there's some very popular ones out there that do not meet this requirement. You should be passing and looking at your ISO standards and your HIPAA to make sure that your HIPAA, CAP, CLIA, and Privacy Shield compliant. We also pass GDR, which is for Europe. Security standards. Passwords should comply with Active Directory, a single sign-on, or whatever the customer needs. We should be able to integrate with every single EHR that's out there. EHR, we should not be limited. We should be able to integrate with all instruments and middleware. Customer software, we should be able to integrate with digital pathology software, which is so coming and so many people are inquiring about now. Patient portals and every third-party application. A system should easily be able to import historical data. I ran into a system with an upgrade, and because of the way that the software was put together, there was no historical data that was allowed to be upgraded into the system. The healthcare system had to go through 3 to 4 years of painful with no patient history until they started to develop their own. All the stuff had been shipped into a separate database, and they actually had to sign in and look through a separate database, which really isn't great and conducive for a laboratory. No one should have to go through that. To run, you should be able to run from local installs and servers, or you should be able to run from a cloud-based management system like AWS. The system should not slow down during peak usage. The access to laboratory software should be available in any modern browser. A good quality control program with the ability to do statistics and reporting should be part of the LIS system. A system that considers the laboratory's workflow is very important. And user profiles should be easily set up and maintained, allowing access to data required for the position. Allow for electronic signatures in any area, not just pathology. They should be an excellent report writing tool or multiple report writing tools available. You should be able to have advanced data extraction and reporting tools. And you should have the ability, or at least access to machine learning and artificial intelligence, which, you know, they say it's up and coming, but it's not. It's in the here and now, and we actually have a tool that allows for that, that can facilitate laboratories. The system should have an audit trail that is informative and easy to understand. It should have a filterable patient history, and the LIS company should be willing to partner with its customers and to take feedback from that partner to improve services for all. Upgrades should not take the system down for more than a few hours. And I'm talking upgrades, not updates. And it should be scheduled to the customer's convenience. I remember working with previous software, and we had to do it at night, and we had to pay actually big bucks to that company to allow for that to be happening. That shouldn't happen. You shouldn't have to pay for that. Updates should take a minimum, when it's just an update, it should take a minimum of maybe 15 minutes to half an hour, and it should be set to the customer's schedule so it doesn't interfere with peak times and cause any problems with the system. There should be no need for third-party middleware. I mean, middleware became very important because the laboratories wanted some control and wanted to be able to set up their validation rules and control that and take care of some of their quality. But with a good LIS system, a middleware shouldn't be necessary. There should be no external database needed, especially for historical data. There should be no virtual desktop services like Citrix needed. There should be no third party needed for quality control software. You should have a great software within your LIS. A company should be constantly offering continuing education to its customers. And a company should always be looking to the future and looking at the fast changing environment of the laboratory. Because let's face it, the laboratory, like I've shown in some of those pictures, has advanced in leap and bounds. When considering a new LIMS product, consider the company's database technology. When purchasing a good LIS, the product should save you money in the long run. Why? Because you shouldn't need all the third-party systems for the system to function properly. You know, you shouldn't have the need for Citrix and all of the staffing and the maintenance and that's involved with it. Your quality control software should be within your LIS, and you shouldn't have to have a third party to make up for deficiencies in your LIS. Middleware used for the validation rules and controlling your interfaces, you shouldn't have to have that. If you've got it, then your system, your LIS should be fully integratable with that system, and it should be easily done, and it shouldn't take a long time to build that interface out. Reporting tools, you shouldn't have the need for expensive third-party reporting tools. You shouldn't have the need even for a separate reagent manager system. MIPS, the MIPS, coming back to the pathologists, they shouldn't have to pay a billing company to extract data for them. They should be able to supply that data to the billing company, and it should be able to save these pathology management groups billing costs. And there should be labor savings, because you no longer, the report should be able to, the laboratory should be able to write their own reports with ease. The laboratory should be able to maintain a system and take control back. So there'll be time saved, which is savings for labor in the long run. Laboratories are usually money generators for hospitals and a healthcare system. The proper software will save money in the long run and increase profits. The laboratory should be able to take control and take control back for their own system and not give control to the healthcare system and be at the healthcare system's mercy. The laboratory should be able to control its own auto-validation rules within the LIS and not have to rely on a middleware. They should be able to build their own reports, have their own statistical reporting tools. They should be able to do uploads and downloads from the system very easily. Maintenance and licenses should be maintained by the laboratory. There should be ease of use of the system and easily trained on the system. And the system should be a general system that functions for everything the same way. So dictionary builds, user access, security, interfaces, instrumentation is standard across the way, so that laboratory staffing and laboratory maintenance and laboratory can take care of their own system. Labvantage Medical Suite, to let you know, we meet all these standards. We are one of the few companies that pass the FDA 21 CFR standards for audits, e-sign, and access control. That's why it makes us very preferable for CROs and clinical trial study laboratories. With LVMS, there's no need for a Citrix environment. You can run the application from any device using any modern browser application. LVMS is one platform for all LISs. It's functional, friendly, modular based. It allows for multi-site, multi-disciplines. It's got a common data model. It's got a user interface, and system administration can be done with ease. 100% web-based, and it's workflow driven. LVMS has developed a type of middleware called LV Connect that runs parallel. It runs on a parallel server to the application servers, and it controls all integration and interface and analyzer interfaces. It acts like a type of middleware. What this allows and what this means for the laboratory is LV Connect will stay up and running if your operating servers go down, allowing for a functional laboratory during downtimes. LVMS links to digital pathology software, has a doctor's portal, an external portal can be built out, and allows for scanned requisitions to auto upload and fill in the request with just some special OCR software that's good, that needs with that, and some mapping on our end. It should be, our system is workflow, so we can set up tram lines. We call these tram lines, and they can be customized per user, and tram lines can be customized for the workflow for the area. We allow for automation. We have very easy to set up automation and rules. We have a technical validation area, so anything that fails auto validation rules will hit this technical validation, and there's a lot of areas and a lot of things you can do in that area to be able to approve results to go out. And we have a medical validation area as well. So if you have malaria, you have certain assays set up that need a doctor to see it, or a supervisor, that the test can be set up, or you can force something to go to be reviewed by a doctor or supervisor. I think of malaria on a slide years ago. And we have a very, very excellent quality control module that shows all statistics, and it works well with interfacing with the instruments. Here you can see that we have patient reporting. You can see there's different styles of patient reporting. We can add different logos to it. We can be customer driven. It can be laboratory driven. It can be department driven. There can be colors that can be added to the report. You can see on the right, those are antibiotic resistant and colors. We can send out through HTML and HL7 and XML format. And we allow for invoicing. We do not actually have accounting software, but we interface to accounting software. We have statistical tools that can allow for management reports, quality reporting, and KPI reporting, and regulatory reporting as well. And dashboard settings, we actually have the ability to be able to report and show dashboards. They can be personal dashboards set up for a laboratory, or dashboards set up for an individual user. They're easy to use, and there's full training available for it. Labvantage truly partners with their customers. Each customer has a voice in product development. Labvantage will incorporate the suggestions into software upgrades and releases for all customers. The Labvantage product is an out-of-the-box product. It's easily configurable, and it's very highly configurable as well, even to the point of languages within a user. There could be a person speaking French and a person speaking English in the same lab, and they could have French or English on their user profile, so they can see that at a different language. And we can change the language of the screens as well to accommodate laboratory workflow process workflows. We are going through constant development and working with customers on that. And we have integration with digital pathology, and we have a reporting tool that's with our 8.7 LIMS platform that we can link in directly with TCG Digital, which allows for AI and machine learning capabilities. This is a roadmap. So Labvantage actually has a roadmap set up. They hit for certain quarters, and they try to meet each of these standards, and this gets updated and is available to customers. And the customers do have input into the roadmap, to make sure that we work with the customer to improve the system. And we look to the future. Right now, Labvantage will save you money basically because it's actually very well priced. And it really eliminates the need for a lot of third-party applications needed within the system. This slide right here, Labvantage is actually partnered. It looks to the future, and we've got new development that's happening. We've partnered with a company called Holo4Med, and what this is a virtual reality. So virtual reality is becoming realistic for the clinical laboratory because we've partnered with them. Right now, they've got it set up so that they can do as a healthcare technology, and the healthcare technology is being adapted to the laboratory. There are many uses for this type of technology, including patient registration through laboratory or through to laboratory functions like grossing. So you can imagine wearing this protective headgear, which I'll switch to the next slide. And you're in a grossing station, and you'll be able to just point. I go back to the previous slide, and you can see the slide on the right. You just point in the air, and you're going to click on an area, or you're going to do dictation, or you're going to do voice recognition, right by pointing in the air rather than actually touching a tablet or a keyboard. You could be anywhere in the laboratory, and you could be filing results by wearing one of these headgears. So it could be the future with no keyboards needed at all. So that's the future. Labvantage looks to the future. Labvantage works with its customers, and it's one of the best companies that I've had the opportunity to work with and for. And that's my presentation. So would you like to take over?
Yeah, hi, Sandra. Great. Thank you so much for that. Much appreciated. Great presentation, of course. Lots of detail. For the folks that joined after we kind of did our initial thing, go through a couple things here real quick. First and foremost, let me get the recording stopped.